Have you ever thought about how something meant to, say, ease pain could also have this really potent other side?
Absolutely. It's a fascinating paradox sometimes.
That's kind of what we're diving into today. We're exploring a substance, acetanilid, which was used historically but can cause some pretty significant physiological shifts.
That's right. Acetanilid, also known as antifebrinum. We're using William Boericke's homeopathic materia medica as our main source here.
Okay, so the mission really is to get a handle on its key properties and effects, specifically from this homeopathic viewpoint.
Exactly. Understanding how it was seen to act.
Right. So, where do we start? What are the sort of core actions Boric highlights?
Well, the text positions acetanilid primarily as a depressant. It affects key systems like the heart, weakens its function, slows breathing, and also drops blood pressure.
Depresses heart, respiration, and blood pressure. That sounds quite serious.
It can be.
Yeah.
Boric mentions potential outcomes like cyanosis, that bluish skin from lack of oxygen, and even the risk of collapse.
Wow. And there's more, isn't there? Something about cold sensitivity in blood cells.
Yes, exactly. An increased susceptibility to cold is noted, along with the destruction of red blood corpuscles.
Which would lead to pallor, that paleness.
Precisely. That lack of red blood cells makes the pallor a key sign.
Mhm.
It shows just how broad these initial impacts are.
Beyond those immediate physical things, the neurological aspects seem, pretty interesting.
They really are. The text lists sensations like feeling faint, but also this very peculiar enlarged sensation in the head.
An enlarged sensation. Huh. And then there's the mention of moral depravity. That one really jumps out.
It does, and it's important to, contextualize that. Moral depravity likely wasn't a clinical diagnosis as we think of it now.
More like an observation of behavior.
Probably. An observed change in behavior or disposition alongside the physical symptoms, it really highlights a maybe different historical perspective on that mind-body link.
It certainly does. Okay, shifting gears a bit. What about the eyes? The effects sound quite specific there.
Very specific. Boericke details things like pallor of the optic discs, the nerve head at the back of the eye becoming pale.
Okay.
Also, a contracted or narrowed visual field, shrinking retinal blood vessels, and mydriasis.
Widrius had pupil dilation, right?
Exactly, dilation of the pupils. So quite significant changes within the eye itself.
And the cardiovascular system, you mentioned the heart depression earlier, it seems particularly affected overall.
Absolutely. Boericke describes the heartbeat as weak and irregular, and that's often seen alongside those blue mucous membranes we talked about, signaling poor oxygenation.
Any other related signs?
Yes, the text also points to albuminuria, that's protein in the urine, suggesting possible kidney stress and edema, so swelling, particularly in the feet and ankles.
Which points towards circulatory issues.
Often, yes. It fits with the picture of a struggling cardiovascular system.
Now, Boric also compares it to antipyrin, another drug, and mentions dosage, doesn't he?
He does. Antipyrin was, another common pain reliever and fever reducer back then. Acetanilid itself was used historically in larger doses, maybe 1 to 3 grains, as a sedative or for headaches, neuralgia.
But the homeopathic use is different.
Quite different. In homeopathy, it's prepared using the third potency, which involves significant dilution and succussion, a very different approach to dosage.
So, bringing this all together, what are the key takeaways for you and for our listener from Boricke's description?
I think what really stands out is the range of effects. Acetanilid clearly has potent actions on circulation, breathing, the nervous system.
Right.
And those more unusual symptoms, like the head sensation or that moral depravity term, even needing historical context, they really point to a complex interaction within the body.
It really underscores that even things used for seemingly simple reasons, like pain relief, can have these widespread, complex effects.
Exactly. It's not always straightforward. So, to sum up, Boericke paints a picture of acetanilid as a substance with truly far-reaching physiological consequences: heart, lungs, blood, eyes, even mental state observations.
A really comprehensive impact. And that maybe leaves us with a final thought for you listening.
Yeah.
When you see such diverse effects from just one substance, what does it really tell us about how incredibly interconnected our bodies are? And maybe how even compounds we think are simple can have profound, varied impacts we might not expect.
It definitely makes you appreciate the complexity both of the body and of these substances themselves, doesn't it? Food for thought.